extreme heat. You may be one of millions of people going to be caught up in this heat wave. It's spreading across the United States. And know that the longer that this goes on, the worse the impact is on your body. Dr. Leigh is a board-certified emergency medicine doctor. And doctor, what should we know about heat exhaustion versus heat stroke and the risks of both? Good morning.
Good morning. So heat exhaustion it's a continuum. So that's when you first start to get heat illness. And, what happens is our body uses sweat to cool off. If it's really, really humid, we can't do that. If you're dehydrated, you can't do that. And you start to get nauseated, vomiting, you could have headaches. And then if you don't get out of the heat, it continues to heat stroke. And that's where our body's thermostat goes haywire. So the sweating mechanism doesn't work anymore. So people can feel hot and dry to the touch, and they can have temperatures up to 106. And the reason it's called heat stroke, Robin, is because they start to have central nervous system symptoms like confusion, coma, and seizures. And that's a true emergency. You have to call 911 and they have to go to the hospital right away.
Okay, so at that point, you're calling 911. So how do symptoms come on differently when you are in, let's say you are in an arid climate and the temperature is 110. But let's now say that you're in a humid area and the temperature is 110. Does it affect how it happens to your body differently then?
Well, the more humid that it is, the harder it is for sweat to evaporate. But still, 110 in an arid climate, if you don't come in from the heat or you're dehydrated and you can't sweat that effectively to cool off your body, it's still going to be an issue. And the people that are most at risk are the very elderly, the very young, and there are certain, medical conditions, diabetes, high blood pressure, heart disease, and those medicines that you sometimes take for that, like blood pressure medicines or antidepressants, they can put you at risk too, antihistamines, because they cause dehydration.
Besides the obvious staying inside and drinking water and being in air conditioning, if you cannot do that, how can you prevent heat illness?
Well, obviously, if you have a choice and you're going to do your own gardening or something, you should do it before 10 in the morning or after 6. But if you are on a road crew and you don't have a choice, you need to try and have something set up for some shade. You need to take frequent breaks and drink a lot. And you really, it's interesting. People are talking now, should we have heat warnings where people like outdoor road crews don't work? You wouldn't send a road crew out if there was a tornado warning or tornado watch. So people are talking about, should we have these warnings for high heat index too? And I believe they should.
That's a good point. It's a very good point. You know what else I noticed too about ways to try to guard yourself against heat illnesses? Caffeine is a no-no. Why is that?
Yeah, because that's another dehydrating agent. Also alcohol, grabbing a cold beer sounds great, but that can also dehydrate you because they're diuretics and you urinate more with them. And when that happens, you can get dehydrated.
Okay,
so they're not the best drinks, plain old water.
Now, because maybe you did not drink enough water and suddenly you are cramping up, you're having some muscle spasms here. Other than drinking water, what else can help? Can you will consuming potassium like a banana help, or no, not immediately?
Well, immediately it's because of dehydration. So water is the most important. You can have electrolyte drinks. You can, have a banana. But the most important thing is that's your body telling you to try and get out of the heat, to try and cool down. And if you see someone with heat stroke, they can't help themselves. So you have to do that for them. And you shouldn't put ice on them because ice can actually constrict the blood vessels in the skin, which kind of defeats the mechanism that we have to cool down. So just regular room temperature water, which will still be cooler than their own body temperature if they're in heat stroke.
Yeah.
But the key is to get out of the heat.
All right. Thank you so much. Appreciate helpful information from Dr. Leigh this morning. Appreciate it. And by